And I coordinate our working group on quality in social services at the European Social Network, and that is on quality in social services in general. I'm not an expert in quality in child protection or family support services. Just for the expectation management, I will not show you very deep insights on quality in family support, but more what happens on in general in quality assurance across Europe, and what the current EU initiatives are to support quality insurance in social services. And first I will present you about the SN and what we do on quality in general. Then some insights how we in the quality working group and in the SN have defined quality in social services, the EU frameworks, some trends that we have discussed in the quality working group, and some initial outview on the proposal that we will put forward on the EU frameworks on quality in social services. This is still work in progress. So the final framework will be ready in 2025. And then some links for our work on child and family support that you can also then look up best practices that I will very briefly mention that may be helpful for your research, and how you can engage with DSN as a researcher. So we are a community of public authorities at regional, local, national level. We have the Spanish Ministry for the Agenda 2030 and Social Rights. We have half of the Spanish regions as member. We have Spanish cities as member. In Portugal, we have the city of Lisbon. We have Santa Casa de Misericordia. We have the Instituto de Seguridad Social. In Croatia, we have the National Ministry. In Zagreb, we have the Gerontology Institute in Belgrade. We have DIVOSA in the Netherlands. We have some, also an organization representing professionals in social services in the Netherlands. So in Italy, we have also a lot of members from local authorities. So I think we have members from all countries that you come from. And currently it's 180 members, and we cover more than just EU member countries. It goes beyond the EU membership. And our mission is to inspire social services leaders to improve the lives of people in the community. And we do that by organizing seminars, events, best practice exchanges, by doing research, by publishing for them guidance, how they can improve the service. And we also help them to do exchanges between themselves. So we have a special funding program where we pay for mutual learning visits between different countries. Like a little Erasmus for social service workers. And yeah, these are the different types. Departments of public authorities, associations of directors. You see here the leaders. This is also represented in the commission, the professional associations, providers and NGOs as well, inspection and regulation bodies. This is important for our quality working group because they are part of the quality working group, and applied research organizations and universities. For example, we also have a working group bringing together research and practice. So yeah, universities also can get a lot from European Social Network because they can access the practitioners. And these are some of the publications that came out of our work on quality. So we didn't start with the quality working group. The quality working group was started in 2022, but our work on quality goes back much more in time. In 2010, we had a seminar on contracting for quality. Because why contracting for quality? Because in many European countries, public authorities contract out services, and they need to secure that the service has a certain quality. So there are very few services that are entirely provided by the public authority itself. It's often contracted out, and it's important that in this contracting process, quality is also ensured in the contracts and also checked. In 2019, we had our biggest conference, the European Social Services Conference, which was last week in Antwerp. We had it on the topic of quality in social services, and after that we had a publication with on key principles and how quality can be assured based on the discussions. In 2020, during the Corona crisis, we had an online seminar on putting quality first in long-term care. So more specifically, how quality can be achieved in long-term care through contracting and also quality frameworks, best practice exchange, and there we have also a publication on this. And then these are the outputs of the quality working group that started in 2022 that I will present later on. And here, when you look at the presentation later, you can also see more in detail what we have published. And what we also do on quality, we have in Malta a view of quality in the services managed by the Foundation of Social Welfare Services. It's a foundation close to the state and that finances and provides social services. In Albania, we have supported the government in the development of standards framework. In Spain, we support the Guipúzcoa province in the development of a care quality agency. So I think there is no care quality agency at national level, so they try to build one up in the local level. And peer learning visits are already mentioned, and the quality working group. And when we discussed how to define quality at the big conference in Malta, we asked different people what they think quality means for them. So we had a self-advocate from Norway who said that what is important for me in terms of quality of care is that I decide who, what, where, and when provides the personal assistance that I need. So that the person is in control of the care that they receive. A former social services director from the UK said, quality should be about maintenance of people at a given level of dependency, but about working with them to move from dependency to rehabilitation, recovery, and reablement. And I think there he was specifically talking about long-term care. And then Eloy van Hal, founder from Hoogeweg Services for people with dementia. Hoogeweg is a village for people with dementia. They live there in a community-based setting. Maybe the colleagues from the Netherlands have heard about it. And the founder said, for us, quality means organizing care in small groups in a community setting with person-centered services provided by a known small team and not being confined in a nursing home. So there we also have this movement of institutionalization, providing community-based services also for challenging groups as people with dementia who may normally may need restricted freedom of movement because they may get lost in the city. And then Peter McLeod, the former chief executive of Scotland's Care Inspectorate, said, I need to assess that the individual is able to say, I am experiencing high quality care that is right for me. And there we also see in this sentence a trend that we have person-centeredness also in care standards. And I will later on also explain more about these I statements that are now used in several countries in care standards. Another definition more from the International Standards Organization on what is quality is the appropriate delivery of a mutually agreed service or product. And in the next slide, I will also explain who actually agrees, because we have, of course, the people who need the service, but we also have the people who pay the service, which is in most of the cases the public authorities, and the provider that provides the service. And in quality assessment, we have identified two large areas. So one is assessing the actual service. For example, how well is the service that a family receives, like you are assessing, or more general in a system, where you see what are the outcomes that the system provides to a child or to an older person in terms of quality of life, for example. And there in this assessment, we also go, which comes up to the next slide, more to an assessment of outcomes than inputs for the person. So here you see this triangle of the people who negotiate the quality, who define the quality, the providers, the people using services, and the finances. And in addition to this triangle, we have the inspection and improvement agencies that are developing more and more, who are supposed to inspect if quality is respected, and we also support service providers in becoming better and provide better quality service. And just in short, how can quality be ensured? There is, of course, legislation which lays out the minimum standards that should be respected. And then there are quality frameworks and standards that are trying to push the service providers to a higher level. We have quality inspection that checks if the legislation and the quality frameworks are respected. We have the element of procurement and commissioning, where also quality can be put into the contracts. We have external evaluators. For example, there is the International Standard Organization that can also assess quality, it can also assess care providers. And there are also a lot of national certificates of quality that have been developed for different user groups. We have guidance on good practice that is provided also by the inspection agencies, and workforce support and training is also a very important element of ensuring the quality of the service. And at EU level, there are already policies and frameworks in place, but social policy is often the responsibility in many cases of the national and the regional government. So the EU is more having a coordinating role or a guiding role, but it's not hard law in most of the cases. We have the European Pillar of Social Rights, and there the topic of quality is part of several principles of the European Pillar of Social Rights. It's some rights that governments have agreed that they think should be guaranteed to people by in social care and support. And we have Principle 11: children have the right to affordable early childhood education and care of good quality. And then Principle 18: everyone has the right to affordable long-term care services of good quality, and the same also for access to social housing and housing assistance of good quality shall be provided for those in need. And there are different policy instruments to achieve this. We have the voluntary quality framework for social services, which dates back from 2010. I will explain more about it later. And then we have the guidance, for example, that just recently on integrated child protection that you mentioned one of you mentioned on the first day. And then we have other specific frameworks on quality and early child care and education. And also there is a council recommendation on quality and long-term care. And this council recommendation from 2020 spells out different principles of quality in long-term care. And there you see that they talk about principles there, because it's hard to agree between member states on something more concrete than principles, because we have 27 care systems and it's quite difficult to agree. One which is more hard law is when it comes to the EU internal market, because all the service providers, they are they are providing services in a market and they have to obey to certain market rules. And when public authorities contract out services, they cannot just take whatever provider they would like to choose. They have to respect normally that they go for the best price, because public authorities have a certain budget and they need to do what they can with this budget. And so normally they have to go for the cheapest offer. But actually, in the EU Procurement Directive, it says that public authorities should always look at the price-quality ratio, and they can justify also why they take a provider which is more expensive, as long as the service is also better for the price that they ask. And this is very important, because often it's said that public authorities have to go always with the cheapest provider, and it's EU law and they have to do it. It's often that they think it's they can be maybe attacked by the provider that was not chosen, who was cheaper, and they don't want to risk a trial of court. But actually, they could, if they are well prepared, choose a provider which is having a more complete package, for example. And then what is currently in development, there is also a framework on social services of excellence for people with disabilities, which is under discussion this year. And also maybe a review of the voluntary framework of 2010, but that's not yet very clear. You know, we had a new commission, we have a new commission, we had European Parliament elections, so the decisions for the next 5 years, they will only be taken in the next month and years. Shortly on the voluntary European quality framework, did you discuss that framework when you were yeah? So this framework is the first pan-European framework on quality in social services that defines some key principles of quality, and it was published by the Social Protection Committee, which is an intragovernmental body of the EU to help national governments to develop quality frameworks on their own, based on these basic principles. And it has 7 general principles, such as availability, accessibility, affordability, person-centered approach, comprehensiveness of the service, continuity between different care settings, for example, orientation towards outcomes. And then it has some specific dimensions of the relationship between the service provider and the users, the relationship between service providers, public authorities, and other stakeholders, such as, for example, good governance, and human and physical capital. In 2021, the Commission asked to make a study on if this is used by member states. And the outcome was quite low, so there's very low take-up of this quality framework. So the goal to inspire national governments to write quality frameworks according to certain principles was not really reached. You see, in Eastern European countries, it was picked up because they didn't have often a quality legislation until 2010, and then they looked for EU sources to inspire themselves. And also in Spain, in the National Catalogue for Social Services, there is a reference to the quality framework, but in the other countries it's not really relevant, and especially at regional and local level, the framework is not known actually. So it didn't have the impact that it was supposed to have. And here also in the summary, someone from the Commission presented at the quality working group, and there they said that there is appetite to review this quality framework in the next years to make it more relevant, and that it's maybe then better taken up by member states. So what are the trends in quality assurance that should be taken into account also when making quality assurance frameworks. We have several trends. So I talked about inspection agencies, and in the past, inspection agencies there were looking into services only from an input perspective. They were checking in the care home how many square meters were there, how much staff was there, and if there was the doors could open in case of fire alarm, but they were not really looking at if the person have a good life. And this has changed over the past years, that they now look more into the results of how do people experience the quality of life than looking at this only on the inputs. And this is one of the major trends. The quality standards are more and more looking at outcomes of the care provided than the inputs. And what is good quality of life? This is something that needs to be defined also in dialogue with the person. I think you talk about children involvement, for example, and it's the same for all people using social services, that they need to be involved in defining what is the best for them, for example, in joint care planning, and also in joint inspection, for example. In Scotland, for example, there are former children that were in child protection services. They inspect residential care facilities for children in child protection together with the professionals. So they get training, and then they go into the facilities, they interview children, how they feel about the service, and this is to have a better view on how children perceive the quality of the service. So there we also see that quality assurance becomes more and more person-centered. And then another example I have from disability services, that it is in the municipality of Randers, there was a care planning with the person with disability, and it was not really accessible, and the person with disability they were not really involved, and they invented a methodology to prepare the care planning with the person with disability, with icons, for example, that they could easily define what they wanted to achieve in the life and how social services can help them to do this. For example, to become more autonomous. And here is another example how the involvement of people in co-production is also promoted in quality frameworks. This is a self-assessment framework for support services in Scotland. And these are different categories that are used for service providers to check themselves if they provide a good quality of care. And in these different categories, one is that people get most out of life, and how well is our care and support planned. So we have again here the involvement in care planning. And what the category here that is checked is carers, friends, and family members are encouraged to be involved in the care plan. When we talk about outcomes, we have here one example from one of our publications, how it could be, for example, done for children. For children, outcomes of care could be, for example, on the emotional level, that they have nurturing relationships in whatever setting they are. On the legal from the legal point of view, that they have legally secured permanent home, and on physical, that they have a maximum number of placements, or it's actually the minimum possible of placements, so they are quite quickly referred to a permanent place. And the indicator for that could be, for example, that children are taken into alternative care, get a recommendation for a permanent home after a certain number of weeks. to ensure that they are not in a limbo situation for a long time. And yeah, one of the trends that I mentioned is the number of quality agencies. The Gipuzkoa, they are trying to set up their own, and there are in a lot of countries quality agencies being set up. In Ireland, UK, Finland, Sweden, Malta, France. In Ireland, the quality agency for children's services is TUSLA, so they have a lot of interesting material as well in English. So you may also use it for your research. It's quite comprehensive what they have. And those quality agencies, as I said, they don't only go into the service and say you did this wrong, you did this not in the right way. They are more accompanying social service providers now and helping them to get to another level. And part of this is the provision of online courses, guidance, self-evaluation tools, as the one that I showed you before from Scotland, proposals for improvements, programs that the providers can also provide to their staff to learn how to provide better quality care. And here we have, for example, TUSLA. They have elaborated a guidance on effective conversations with children and parents. So that might be useful for your work with children and families in different states, how to prepare a discussion. And then on a general level, there is we talk about service integration, and this is also the case in quality assurance. In several member states, quality agencies they used to have different quality inspections for health and social care, but social care providers, for example, long-term care, they provide both health and social support services. This is why in England the quality agency has developed one single assessment framework for social and health services, so they don't get visits by different inspectors at different times, but just one inspection, and then they can go back to their work. So this also reduces the stress of an inspection. And this is how this framework is organized. They inquire 5 key questions. Is the service safe? Is it effective for the person? Is it caring? Is it responsive? And is it well led? And then they check this with different statements. And these statements are important because we also use these statements in our proposal for a new European quality framework for social services. So they have five statements based on what people expect and need to bring these questions that are on the right side into life. And then restatements that are standards against which the local authorities and care providers are held accountable. And then the evidence that they use to measure if something has been respected is people's experience, feedback from staff and service leaders, feedback from partners, observations, and the processes and outcomes. So it's a mix of different evidence bases, and then they have some other specific quality indicators. I will not go in detail there. And one other trend is the institutions with disabilities, and they can buy their own services, personal assistance. And there, the question is how to help them also to assess the quality of the individual service that they receive in their homes, because they become the buyers of their care. So it's not this triangular, it's what the person directly pays the service provider. So now, an overview of our proposal, and it's still work in progress. So So why do we need, just to repeat a bit what I said, to summarize what I said, the EU guidance on quality on social services dates from 2010, so we think it needs an update. And it's also mostly unknown, and it's probably for a reason that it's unknown. It seems to have not been really seen as useful, and we want to make it more useful for public authorities. And it's also very broad. We think it should go beyond general principles and also have a more better defined field of application. You talked about the need to define the field of application of a quality framework. And when we, for example, talk about affordability, do we then assess the system? Is the system providing for affordable care? And then it's probably not the provider that needs to be held accountable for that, because the provider has certain costs, but then it's the state that needs to provide the means for every person to buy the service or to buy the service for them. So then we cannot really hold providers accountable for that. And in these general principles in the EU framework, it's not really defined what principle is for which setting. Is it for the system? Is it for the provider? It's all not quite clear, and we think it needs to be more closer defined. And we also have these trends that I mentioned before that we think should be further stronger involved there. For example, the provision of community-based care, that is part of the evaluation. And so how we developed the framework? In 2020 we met and we made a general review of what quality frameworks exist. From there comes, for example, the slide of the CQC framework from England, the Integrated Health and Support, the Health and Social Care Quality Assessment. In 2023 we discussed what key principles we want to keep, which key principles do we want to add as a basis for the framework, and also the application field. And this year we discussed how we can translate the principles into more concrete standards. And then over this and the next year we will discuss these initial ideas for standards with people using services and professionals. So each member of the working group will take this draft that we have home to their country and discuss it then with people using services and their colleagues. And for us, we say we would make a proposal for the service level, and that can be then a basis for member states to either use this or to develop, based on our proposal, a national framework for social services providers. And yeah, we want to offer a common language across Europe for public authority service providers and people to describe what high quality social services look like. We have the European Pillar of Social Rights, which says the child has the right to access good quality care. Older people have access to good quality care, but it's not really defined. Okay, what does it mean? And this could contribute to make something, more concrete, to give people in Europe a more concrete, idea of what good quality means. And when we discussed the principles, there were a lot of discussions. What principles are the most important? So this is a list of all the principles that were discussed during the meeting, and we found that a lot of them can be subcategorized, and we finally came out with 6 key principles, which was the human rights-based approach, the person-centered care, safe services, community-based services, outcome-based services, and well-managed services. And then this year we defined standards that could fit to these principles. And the principle of outcome-based didn't have a separate category, because we said all of these standards that are here, they should all be formulated as outcomes. So we have 5 categories in our framework. And what we asked our members of the working group to formulate was a nice statement that shows the outcome that the person can expect from the service. For my service is safe, for example, and then what the service provider should aspire to meet this expectation of the person. So all the standards are actually also person-centered because the person is always the start of the reflection, what the person wishes. And then to help providers to meet their aspiration, to meet the expectation of the person, we make some proposals of arrangements that they could put in place to meet the expectation. And this is a proposal, so if they find other means to meet the outcomes, that is also okay. But they would need to write them somewhere down and then check against if this has really led to a good outcome. And I brought some ideas, but as I said, this has not yet been tested with the people using services, so they may still change. So for the standard of person-centered, we had different I statements. One of them was, I can easily access the type of support I require when I need it. And the restatement for the provider would be, we ensure that people can easily access the type of support they need when they need it. And then what are the arrangements that should be in place? Our services are physically accessible. Our services are also digitally accessible when, for example, people want to inform themselves on the website. That they can do this also without barriers. Our service is situated in a location that's accessible by public transportation to keep it open for the community around and also for people to easily get there. We ensure information about our services are accessible, including information about contacts, access to our services, details about our goals. We provide information that is easy to understand. We provide our service at times that accommodates the people who use them. Was one point on languages. There I do not know if this will be in the end part of it, but the experts but they said this service should be provided in multiple languages to accommodate diverse linguistic needs. And we collaborate with other relevant entities to reduce bureaucratic obstacles for individuals seeking care. So here it's also about then integrating care, working with other providers to provide a person-centered service. Another example for SAFE was, I feel safe and supported to live my life to my full potential by staff who full and know and to understand my support needs, which is then again met by a restatement. People using our services feel safe and supported to live their lives to the full potential by staff who know, understand their support needs, and then the arrangements in place would be, for example, we have sufficient numbers of competent staff. We have a mix of skills in our teams to meet the expectations and needs of our people using our services. We have robust recruitment procedures. We provide our staff with appropriate regular training. We ensure people using our services have access to and are supported and understand the information concerning their safety. So these are some of the arrangements that were put in place. And then the last example is on community-based. I have the right to maintain and to live my own personal relationships and can define, build, and keep my own personal network. And then we enable people using our services to maintain and build their own personal relationships and networks face-to-face and digitally. So for the people in the discussion, it was also important to help people to have relations also digitally. I think they have, for example, disabilities in mind, or however they interact with their community, they have the possibility to do that. And then we have another list of arrangements that should be in place to meet this. But this is still work in progress, but I wanted to share already some view so you see how we what our methodology was, and it was very helpful to also see what different methodologies you have that helps to agree on such frameworks and standards. As I'm not the expert on child protection and family support. I thought I still bring you some links to reports that we have that you can be useful for your research. So I'll briefly introduce you to these reports as well. In 2016, we published a report on investing in children's services, how to improve outcomes for children. This was based on new initiatives, and we checked how this initiative was implemented in 13 EU countries. And then in 2017, we published a report on how to support children on the move under the impression of the people coming from Syria, and over 1 million people, and many of them children came to Europe. And based on this, we had this publication, and somebody here talked about migrant children. I think the person from Belgrade, how they experienced the journey, which is very happy for them. So this is on this topic. And then we had the working group on integrated care and support for different groups of people, and one of them was children, and one of them was young people. And this was then how integrated support can help children to strive. And the other one was on how young people that leave care can be supported in the transition to adult life. And last year we had a seminar on community care, and this was actually in Spain here, on the Iberian island. And there we also discussed how the community care can be provided for children. And here are some of the practices that we have. So you can go on the website on practices, and you have a drop-down list with the theme and the country, and you can check if there is any in a certain country to the topic of family and child support. There is a practice that might be interesting for you. And at the seminar, for example, there was a project presented from Sweden, Home First. So in Sweden, for a long time, the philosophy was, as soon as the child is at risk, we take the child out of the family and place it in the foster family, and the contact with the biological family was stopped. And in the 90s and early 2000s, children that underwent this procedure, they went into court against the state of Sweden. They said this was hugely damaging for us, to being uprooted, to not have contact anymore with our biological family, and we were our whole life suffering from this experience. And several of you have talked about how we need to better support families instead of taking the child out, and you said that most of the families do the best they can to support the child, but they have some restrictions. And this in this project, they developed a method how to keep the child in the family. There was one method which was called signs of safety, with certain guidelines to assess if the child can stay in the family, with a certain support in the dialogue, with close support. Somebody could come every day to the family, in details you can find this here on the website. And I think it could be interesting for a few people here in the room. And then you have others, like One Family, One Plan. This was presented in Antwerp last week. We talked about integrated child support, and that families should have one interlocutor that helps them to get the support that they need. We have Through the Eyes of the Child, a study from Tuzla on child protection system, based on interviews with children. So this is also quite interesting, involvement of children. Then the young care inspectors that I mentioned were former children in child protection inspect residential care for children. And then also Spanish practice on indicators for child safety, for child support leavers when they turn 18. So very different practices that may be interesting for you. And on 30th of September, we have a seminar on protecting children working in partnerships across children's services. So there's also about integrated support for children. We have the coordinators of the child guarantee coming to the seminar. We have DG Just coming. DG Just published the guidance on integrated child protection, and they will present it there. And we have places available, but those who are not our members, they have to pay for a fee for that. So I don't know if your universities they can provide for this fee, but you have all information on this QR code. And then also for researchers who are implementing projects on research, we have the European Social Services Awards. It has different categories. This year the topic is promoting inclusive communities, and family support is part of this, as it promotes community-based support for children. And you could apply here and present your research to get an award. So this is also something that you could take into account. The application deadline is 12th of July, is quite soon. But if you don't make it this year, you can also keep it in the back of your hands. Also, some people have not yet progressed very much in the research. It may take 2 or 3 years until you have the results of your research, and then it would be time to apply here to make your research known, because it's very important that researchers go out and tell what they find out. And there you have directors of social services, government representatives, EU representatives coming that would then also listen to the findings that you have, which is quite good to get the findings out to the practitioners. And that's the overview. That was the overview. Yeah, that was the presentation.
Thank you.